The study, which is funded by the National Institute of Health, is really trying to understand what are the risk factors that cause brain aneurysms and then cause them to rupture. And specifically, we'd like to find the genes or the part of our chromosomes that put us at risk, or certain people at risk, for developing aneurysms. Now, the reason why it's a big study is because you need a lot of people with brain aneurysms, and you need their DNA, so their chromosome material, in order to find the genes that we think may be related. So we need literally, thousands of people involved in the study. So the study is big, but we plan to be getting about 2,000 people additional to what we've already gotten of patients who have a brain aneurysm, either one that has ruptured or one that has yet to rupture. So we're excited, but we got a lot of work to do. We know some things already about why brain aneurysms form. For example, we know that smoking is by far the most important factor that leads to the development of brain aneurysms. Probably 75 to 80% of patients who develop a brain aneurysm have been smokers in their life. So an easy message is stop smoking now, and you immediately decrease your risk of aneurysm regardless of what your genes are like. We also know that blood pressure, elevated blood pressure, can lead to development of aneurysms. But we also know of all the types of strokes, there's probably the most evidence that brain aneurysms are related to a gene component, something in our genes that predisposes us. And I think about a family in town here where, for instance, there were 3 siblings in the same family, all who had a ruptured aneurysm within 2 years, about between age 37 to 39, 2 of whom died. Well, that's clearly not just smoking, not just blood pressure, but there's something in the gene and that susceptibility to the aneurysm in those family that we'd like to find. If we find those genes and we understand what predisposes to aneurysm, theoretically we can prevent them. We can also better know who to screen and which families, who is more likely to develop an aneurysm, and hopefully we can understand better about why aneurysms form, which then improves the treatment eventually. So we think it's very important. It takes a lot of patients from all over the world to sort this out, but we think we have a good chance to find some of these genes with this study. First phase of the study, only people who had had family members with an aneurysm in addition to themselves would have been eligible. But in this phase of the study, we really are looking for anybody who's had an aneurysm that's been diagnosed, and that's ruptured or that's not ruptured but of a certain size. And any of those patients would qualify. There's a few exclusions, but from the patient's standpoint, they probably shouldn't worry about that because we would sort that out.